So you're starting your clinical portion of your psychiatric nurse practitioner program, and you're trying to figure out ways to be successful. And you're probably nervous, anxious, maybe even overwhelmed because you don't know how to prepare for your first day of clinicals. And I'm here to help you guys out. I've been there. I was nervous. I was anxious. I was extremely overwhelmed. But I don't want you guys to feel that way at all. So in this video, I'm going to be going over 5 tips for you to be successful in your first day of clinicals. So stay tuned. Welcome back to another episode of Life of a Psych NP. And if you are new to this channel, let me formally introduce myself. I'm Darty. I'm a board certified psychiatric nurse practitioner. And in this channel, I go over several different subjects to educate the public about mental health, ways to improve your lifestyle, topics related to nursing, nurse practitioners, and specifically psychiatric nurse practitioners like myself. So if you are interested in any of these topics, feel free to subscribe. Make sure you like this video because it helps me out so much with the YouTube algorithm, and it helps me become more motivated to make more videos for you guys. And if you haven't followed me already, follow me on Instagram at LifeofaPsychNP. So you're starting clinicals and you're nervous. You don't know which way to start and you don't know where to even start because, let's face it, you went through your Common Core classes. Yes, you did your advanced Ps and you're now entering the psych portion and you're trying to figure out, okay, how am I going to prepare? How am I going to prepare? Am I going to do this? Am I going to do that? How am I supposed to know everything all at once? And trust me, it's pretty nerve-wracking, and at the same time, there's no clear guidance on how you should prepare, especially if you're going to be in so many different settings, if you're going to be outpatient, if you're going to be inpatient, are you going to be in urgent care? But trust me, if you utilize these tips and watch the whole entire video, I'm going to help you prepare, especially when understanding how to do interviews, when understanding how to look up medications, things like that. So definitely stay tuned till the very end of this video and I will help you out with my 5 favorite tips. So let's go. So my very first tip is learning the ins and outs of an initial psychiatric evaluation and how to do a follow-up. So this is extremely important because this is what we do on a normal basis. We either do evaluations or we do follow-ups, and you have to understand the key components, and you have to be able to ask the right questions, and you have to be able to understand what part of the assessment goes where, and just understanding what are the key components. And that's pretty much the gist of it, is understand the key components, understand where it goes, understand the flow of an initial psychiatric evaluation, and understand how to do a follow-up and which questions we ask. And as long as you understand those things and just have a general gist of what's inside an initial evaluation and what's inside of a follow-up, you'll do relatively well because now you're understanding what we do on a normal basis. You're probably thinking, how about medications? And I'll get to that. You want to make sure you just wait because this is the most important thing. Medications will come, certain questions will come, but at the same time, as long as you know the key components and which parts of the initial evaluation and follow-up you need to know, then you're going to be pretty well off compared to the unprepared student. So my second tip is understanding leading questions that will help you towards a diagnosis. So as many of you guys know, a lot of what we do is going to be the diagnosing component. Yes, we do a lot of medication management, but at the same time, we have to come up with a diagnosis to be able to justify why we're using a certain medication. And the key part of what we do is being able to diagnose appropriately and efficiently. And a good thing to understand is learning about leading questions and screener questions that are able to help you diagnose patients efficiently. Yes, you can probably memorize all the questions to help diagnose, but you're going to be doing that part of the assessment, and it's going to take you forever to accomplish. But if you're understanding leading questions, screener questions, and being able to pick and choose which questions are going to appropriately get you to that diagnosis more efficiently, then it's going to help you out so much, and you're probably going to impress your preceptor. So make sure you know that. So my third tip is understanding basic medications and how they work. I'm not telling you to understand every single medications. I'm not telling you to understand half-life, dosing ranges, or anything like intricate like that. All I'm asking you is learn about the medication and what it's used for. Maybe some dosing ranges here and there, but just understand how antidepressants work. What are the categories of antidepressants? SSRIs, SNRIs, NDRIs. You want to be able to understand that and how they work. So you want to be able to understand and explain how SSRIs work, and you want to understand and maybe know which more common medications that you'll normally use. So like for certain SSRIs, you want to be able to use this medication over this medication due to the side effect profile. So something like that, you want to be able to make sure that you understand the basics. Like when it comes to antipsychotics, you want to understand what the medications will treat and how it's going to treat you and what are certain side effects of it. You don't have to learn every single medication. Trust me, you're not going to be able to learn it right before clinicals. But if you can understand the basic medications that we normally use, especially when it comes to certain diagnoses like depression, anxiety, bipolar, schizophrenia, ADHD, things like that, as long as you gain a better understanding of that, then you'll have a good gist of how you're going to be like inside the clinical setting. And it's if you know a lot of these medications and you understand how they work, you're definitely going to impress your preceptor. So my fourth tip is ask questions now. And as you start to be in an environment, in a safe environment with your preceptor, ask all the questions that you want to know. And it's extremely important you ask all the questions, because at the end of the day, you could read all the books you know and all the books that are thrown at you during your program, but there's certain things that we learn from experience, and there's certain things that we learn by actually doing the work as a psychiatric nurse practitioner that you might not learn in the books. So you want to be able to ask as many questions. You want to be able to see like very detailed information and see like, okay, why do you do this over this? Why do you choose this medication over this medication? Why do you choose this diagnosis over this diagnosis? Because it starts to get you interested in these topics, and it starts to make you think about certain things, and it helps you out, especially once you step into the real world as a psychiatric nurse practitioner. You're going to start to think about these things and utilize these things, especially if they're done appropriately, into making you be more successful from the very get-go, as opposed to making a grip of mistakes and not necessarily practicing safe. So definitely ask questions. For my fifth and final tip for you to be successful as a Psych NP student in clinicals is have fun. This is the biggest thing. This is the reason why we're going to clinicals, is to have fun in learning so much information. Have fun being able to talk to patients. Have fun being able to talk to your Psych NP preceptor or your psychiatrist. Just have fun with it, because at the end of the day, as long as you're successful in being able to understand just what you're supposed to learn as a Psych NP student and having fun being able to learn it, you're going to do awesome. As long as you're asking questions, as long as you know the basics of initial evaluation, the basics of a follow-up, the basics of certain medications, you're going to be set for the long run, especially when it comes to clinicals, because you're going to learn more and more every single day. And the more that you ask, the more that you're starting to pique your interest in this, the more fun you're going to have and actually enjoy going into clinicals. Because let's face it, if you're not going to enjoy clinicals, how are you going to feel when you actually start to see your own patients? Are you going to enjoy it? And you have to be able to enjoy it. So that's why you need to have fun now. Learn the basics, learn in a controlled and safe environment with your preceptor, and just have fun with it. And that's the most important thing. And I love to tell my students this is have fun. We're here to act safely. We're here to be able to prepare together. We're here to make sure that we can provide the highest quality of care possible for the patient, and to be able to provide as much knowledge for you, so once you start to practice, then you'll be safe. And that's the most important thing. Well guys, I hope you enjoyed this video. I hope I was able to shed light, and I hope that you're starting to utilize these tips, and hope you utilize these tips to be able to practice safely and to be able to enjoy your first day of clinicals. You've made it this far, so I congratulate you. Alrighty guys, have a wonderful day. Until next time, bye!